I'm Charlene Chen. I'm a family doctor here at Esperanza, and I work primarily at the KNA site. I've been here for about 7 years now. I am originally from North Jersey, and I went to medical school at Jefferson. That is where I met my husband while he was giving an SMI presentation. So he had gone the year before me. And was sharing about it. I met him at his talk there. I went at the end of my first year, and then I went again during my 4th year of medical school. This was over 10 years ago. It was a long time ago. It was when it was back in Texas and Mexico. So my experience with SMI was a little bit different from your guys's, but I have been able to participate as faculty in Philly SMI for the last well, on and off for the last 7 years as well. So, yeah, I think SMI was a really transformative experience for me. It was where I learned how to just how deeply intertwined our faith is with our ability to both provide and receive care. So I know things are going to be a little bit different for you guys this year, but I hope that you still will be able to see glimpses of how God works in our community and in our healthcare visits. And I hope that you'll feel confident in his leading you here to do some really important work this summer. I'm really excited for you guys and thankful that you get to be working with us. Yeah, that you're sharing part of your summer with us and our community here. So thank you for that.
And can you, I mean, I know Dan works, I saw some people walk in, they're grabbing their lunches. I know Dan works mainly at HP and you work mainly at KNA. Have you guys ever talked about kind of the atmosphere of the two different sites and what that's like? Is there I see a difference, but I don't know about in the exam room. In the exam rooms, there actually might not be a difference, honestly. You see a difference when you look around. But in the exam rooms, is there a difference between the two sites at all? You both seeing both adults, mainly adult patients.
Yeah, I mean, from our personal perspectives, I do a lot of women's health and prenatal care as well. So I think that my patient population in general is different from his, but I think at KNA we definitely see more issues with addiction and more mental health issues. I hear that at Hunting Park, they probably have a higher self-pay population. That was my experience when I was doing OB at Hunting Park too. More of the OB patients were self-pay or undocumented. There's a little bit of a difference. Like I think a lot of our KNA patients, they take the train in. So we get a lot of patients from Upper Darby, or they live like right near our center. At Hunting Park, there's a parking lot here, and it's more convenient, and I think more people tend to drive here. So, yeah, I don't know.
Yeah. So to explain the Upper Darby, if the folks that don't know the area, Upper Darby is actually in another county. It's in Delaware County, right?
Yeah.
Yeah. And can I say their public health department and free clinics? I don't think they even have. I think they have one free clinic in the whole county. I think. And between that and the fact that some of these are also undocumented and self-pay, and the elevated train runs literally from 69th Street, which is right on the border of Upper Darby, all the way into KNA. They can just hop on the train and come in. We have a pretty decent population of those patients. I would say maybe 30, 40 families that do that. And they would rather come to us. Again, you heard earlier today when Mary Ann Silly was talking. They would rather come to us because they trust us with their information. They would rather come to us than take their chances with Delaware County, which is the real free clinic they're supposed to go to. But they don't. They don't want to go there because they don't necessarily speak Spanish. They don't feel like their information will be safe, that the fact they're undocumented will be safe. So they come to us instead. Do you see that too, Charlene? I've noticed that pattern over the last 4 or 5 years especially.
Yeah, I mean, I did my residency at Chest Pen, which is the FQHC in Upper Darby.
Okay.
And yeah, when I came here, I was like, what? Did you know that chest pen exists? And they said, yeah, but they felt much comfortable at Esperanza. Mostly, well, they told me it's mostly because of Spanish.
Okay.
So yeah, I think the fact that we are required to be functionally bilingual here, I think makes a big difference in connecting with our patients. And
I'm going to round up some people. Do folks have any other questions for Charlene in general, just about working here, about SMI experience, about having gone out on the street with some of the teams as an attending, anything like that, and I'll be back.
Did you always know you wanted to work with these populations? Like when you're in high school?
Yeah, I became a Christian in college, and I think and I had already known that I was going to med school, so I always knew that I was going to be a doctor. But then I think when I got to med school and sort of had to decide what specialty to do and who I wanted to work with, I felt I just really feel like Jesus really cares for the poor and the widow, and yeah, it felt like kind of natural to me to seek him in these marginalized populations. So I didn't necessarily know that I wanted to work with like Spanish speaking patients. I didn't speak a word of Spanish until coming here, actually. But yeah, it's this community has really grown on me over the years, and yeah, I'm just grateful to see what God's been able to do.
Okay, Charlene, I've been told that you can start because you're starting with HIPAA, right? Is that right? And
yeah,
Karen Norris will cover a little bit of that herself, more regard, to like screens and stuff that can happen in the office. So she'll review some of that. So if you can start with HIPAA, and the folks that are missing a little bit of your HIPAA will be okay.
Okay, great. I'm gonna share my screen right now then. Oh, you guys can still see my face if I share, right?
I think so.
Okay. Present now. Your entire screen. Share. Oops. Sorry, clicked the wrong button. Hold on, I'm gonna do this over.
Do you have your PowerPoint open?
It is open on Google, in my Google Doc. Shouldn't I just be able to share it if it's open?
I would think so, but I'm not sure I know the answer to it.
All right, give me 2 seconds. If it doesn't work, then I'll just forget about it. Okay, I think it's gonna work.
If you're using Chrome on the present now, you should be able to select just the Chrome browser or the Chrome tab you want to share.
There we go.
All right, and you can still see my face because I can't see you.
No.
Oh.
Not right now.
Is that a problem?
No, I don't. No.
Okay. All right. So anyway, HIPAA. For those of you who don't know, HIPAA is the Health Insurance Portability and Accountability Act. It was instituted in 1996 to help strike a balance that permits the use of information while protecting privacy. And it's important because as healthcare providers, we are not infrequently meeting people in their vulnerable states. While you may not have as much direct patient and person contact this year as is ideal, you will still be learning about sensitive parts of people's lives. These are things we are not entitled to, and we are called to honor and respect their openness and generosity by being stewards of what we are offered and given. And then, of course, we have to take this seriously because of the legal ramifications involved. In your specific context, you may be dismissed from SMI if HIPAA is violated. So yeah, as the Hippocratic Oath says, what I may see or hear in the course of treatment or even outside of the treatment in regard to the life of men, which on no account one must spread abroad, I will keep to myself, holding such things shameful to be spoken about. So, you know, when we talk about HIPAA, we talk about like individual personal identifiers. Can any of you guys name any identifiers that you can think of?
Name.
Uh-huh. Uh-huh.
Security number?
Mm-hmm.
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 Address?
Mm-hmm. Yeah, that's great. Email, fax, phone number, pictures, driver's license numbers. So, yeah, so I thought just sort of to make this a little bit more practical for you guys, we'd go over some cases or some things that you might run into. So what I would like you guys to do is, I'm going to read a scenario. I think you've probably at least skimmed through these already, but I'll read through. You'll see them on the screen. If you think it's a violation, lift up your left hand. If it's not a violation, lift up your right hand. And Laura will be able to see. I can't see what you're doing, so.
I'm looking.
All right, so you are doing a diabetic foot screen and you see an ulcer on a patient's foot. It's necrotic and has some pus oozing out. You take a picture of it to show to the podiatry student in another group. Is that a violation or not?
So left means violation, right means not a violation.
Yes.
Got mainly lefts at the moment.
All right.
One or two rights.
All right. I think for the sake of time, I probably will just go through and give the answers. But if there's any discussion, please let me know. Yes, I would agree that. Well, yeah, I agree with the fact that there are both answers there. I think the fact that if you just took a picture of just the ulcer, I think it potentially could be not a violation, but we do need to be careful if we start showing if we sort of zoom out a little bit and we see exactly where on the body is, if they have certain jewelry or certain tattoos or certain birthmarks that make it yeah, more characteristic or identifiable to a person. So the answer is, it depends on how you take the picture.
And faces always have to be permitted. Take a picture
Yeah.
of the face. That's actually why you guys, I think in your commitment forms or you're in SMI 101 forms, you signed a photo release already. So we can take the picture as much as we want. But for a patient or an Esperanza staff member or something, we would have to get that permitted. And we do have permission for it.
Yes. All right. Number 4. You update the SMI blog saying, yesterday we met a lady in her 30s, Maria, with diabetes, who lived right across the street from Esperanza. She was so kind and timid at first, but when she opened up to us, she told us that her husband was abusing her and her children. Left is violation, right is not.
So yeah, mainly lefts.
Okay.
Yes.
I agree with that. That is a violation. We should not be writing that in the blog with those specific details. If you wanted to write something about a lady and not mention her age and not mention her name, and the diabetes is not important. Neither is the area where she lives. That could be acceptable. The other thing that we need to point out, though, is that she said that her children are in danger, and you guys are mandatory reporters. So that part of the story does need to be reported to somebody. And I mean, the first person I would go to would be Laura or Karen.
So that, can I say that is one other reason why you have my phone number? If you end up with kind of either a medical conundrum on the phone, or, you know, somebody's probably gonna be there with you, there'll be a social worker with you, or there'll be one of the office managers, or I'll be there, or Holly will be there, because we're helping out with all the groups. But if for some reason you find yourself, you know, in a room alone on the phone with somebody and you have an issue, you know, kind of write it down, make sure you have their number, call me. But yeah.
All right, number 6. You update the SMI blog saying, a few days ago, we saw an adult man whose blood pressure was 180 over 100. He has been a heavy alcoholic for 20 years, but he told us that something inside him made him want to stop. He was very interested in coming out to church with us next week. Violation or not?
Actually, most are saying violation. A few nons. Most are saying violation.
Okay. Yeah, I think, you know, the thing to keep in mind when you're writing this is, if I read this, would I know that it was me? And so I think this is pretty vague. But, you know, did you have to say like how specific the blood pressure was? Did you have to say 20 years as an alcoholic? I think those might be a little bit specific. Though I think if you wrote this, you probably could get away with it. But yeah, the more general you can be about these sort of details, the better.
We have one question. Go ahead.
Yeah.
Is it, because I mainly read the last sentence, it's like if someone new came to church, you could identify them as like, I don't know, if there's a chance that he's like, oh, we did come today, and then they introduced him. That's why I would say it was a violation, because you would know it's this person. Isn't that last sentence?
Yeah, I guess that's like, I don't know. I think my thought process is there's a lot of churches and a lot of people going to a lot of different churches. It probably would be hard to figure it out. Like an adult man could walk into a lot of churches and he wouldn't necessarily like tell everybody his blood. I don't know. I think it's probably okay. Yeah, I probably wouldn't specify like, and I told him to go to Spirit and Truth, or and I told him to go to X church. Yeah. All right, number 8. Today I met Mr. X, who got discharged 2 days ago from rehab at Temple Hospital for a stroke and is now on disability. He needs the help of his children and his girlfriend to take his medications, which include aspirin, lisinopril, simvastatin, and metoprolol. He says that the hardest part about not being able to move around as much is his inability to drive. We were able to listen to his struggles and offered to pray for him.
Yes. Violation.
Agree. Can somebody just reword that for us?
Oh, come on. Melissa, you look like you want to. Go ahead.
Today I met a man who was recently discharged from a rehab hospital. He needs help with his children and girlfriend to take his medications. And he says the hardest part is not being able to.
Right.
Beautiful.
Yeah.
The
pharmacist is going to know who he is. His pharmacist.
After speaking with a patient during a survey, you feel that he would benefit from a referral to a chaplain at Esperanza. You tell the chaplain about the patient, and just as a heads up, he was just diagnosed with HIV and was feeling so hopeless, but asked for prayer and would like to go to church.
Okay, oh yeah, all violation, yes.
Beautiful.
Good
So
job.
yeah, I think that is helpful information, but that is not or for somebody to know, but it's none of their business. The chaplains and the spiritual leaders are not allowed access into patient charts, and so their medical information is not is not to be revealed to them. All right, you meet a young lady who at first appears quite cheerful. After spending some time talking to her, you find out that her husband has been put in jail, her 5-year-old child is in the hospital, and she's severely depressed. In fact, right before you arrived, she got a phone call from her boss telling her that she had just been laid off from her job. She feels so hopeless right now and is contemplating overdosing on the 3 bottles of Tylenol she has in her bedroom. You are unable to make her feel better, and she tells you that as soon as you leave, she's going to do it. But she doesn't want you to tell anybody. Sorry, I forgot to adjust this for.
That's okay. You're on the phone with her, and she says,
yeah.
Well, she's in the waiting room. As soon as she goes home, she's going to do it.
Yeah.
You meet her in the waiting room during a survey, and she lets you know all this.
Yeah. So you call Laura, who tells you to call 911.
Everybody think that's a good idea. Good.
Great.
Or if she's actually physically in the clinic, you can flag down a behavioral health person, or I can help you flag down a behavioral health.
Yes.
Somebody needs to touch. It's not a violation. Well, it's not a violation if you are helping save your life.
Okay. You are looking at the schedule of patients for the day, and you see the name of one of the clericals you have been working with. Curious, you hover over her name to see why she's being seen. Violation or not?
Yeah, all violations. Yep.
Beautiful. Just because you have access to information does not mean you should go in and use it if they're not someone you're directly working with. All right. You are conducting a patient survey, and the patient tells you that he was so blessed the time when his doctor saved his life by giving him the right medicine at the right time. And then you go and tell that to somebody else.
Nope, that's good.
Beautiful. As you see a patient with a chaplain, the patient tells you that he stole some money from a neighbor last week. You tell your colleague because you feel concerned.
Most people think that's, but I get the right one. Most people think that's okay.
I guess if you say it in the context of some random person that you met somewhere, that's fine. But just remember the information that gets revealed to you in that context, regardless of whether or not that patient is following the law, is still between you and the patient and whoever else was in the room. So yeah, I think if you talk about it in general terms, I think that's fine. But don't say, Jose in room 1 who lives in that house, or, you can't call the police on them or really do anything else about it.
So basically, Charlene, privilege, quote unquote, extends unless there's physical harm to a body that's about to happen, right?
Right. Right. Okay. So moving on to OSHA. The most relevant part for you about OSHA is infection control. Usually we spend kind of a lot of time talking about HIV, Hep B, and Hep C. This year, COVID is the main threat for all of us. But I will go over all of those. So let us begin. We're going to do true and false. This is going to be true and false. And left is true, right is false. Okay? True or false? The most important.
Left is true and right is false? Okay,
Yeah, left is true, right is false.
got it. Okay.
The most important precaution to take to prevent COVID-19 infection is to wash your hands frequently. The most important.
You got mostly right hands going up, so false.
Okay. Yeah, I agree with that. I think it is a very important thing to do and something that you must do every time you touch any surface that is not yours or inside your home. But it's not going to help you if you're standing right next to somebody who's talking in your face that has COVID. So yeah, staying away from people is the absolute most important, at least 6 feet away. And then when you're not able to stay 6 feet away, everybody wearing a mask is the next thing to do. And then, of course, washing your hands. All right, true or false? It is mandatory to wear your mask in public in Philadelphia.
We got mainly trues. Mainly left hands, mainly trues.
Okay, agree. Yeah, they recently declared that it is mandatory to wear a mask in public. However, the police will not enforce this and may not even be doing it themselves. However, they did explain that the reason that they have said that it is mandatory is to give us some more power as we try to remind our neighbors and friends in the street to wear their masks. We're not just saying this out of our own, desires, but it is something that is strongly mandated by our city. So, yeah. And also at Esperanza, it is enforced. So if you see anybody walking around over the age of 2 without a nose or mouth covering, you may kindly remind them to do so. And then in the situation of those kids who are older than 2 that can't keep their mask on, I would just sort of reiterate the importance of staying 6 feet away and keeping other people 6 feet away. And if you absolutely need to be near them, talk to Laura, because potentially more PPE would be required.
We do have N95 masks. If you know you must be near somebody who won't or can't keep the mask on.
Yeah. And again, remember, you just have no idea. If they're asymptomatic, it still means they need a mask, because you have no idea if they have the infection or not. All right, true or false? You wake up in the morning with feeling a little tired, with a mild sore throat and a mild cough. You're pretty sure it's just allergies. You do not need to tell anyone, and go ahead, and you can proceed with the day's activities. True or false?
Most right hands, so false.
All right, very good. Yeah, please just tell Dr. Layer, tell Holly, tell Karen, tell somebody if you're feeling any symptoms. I think you guys already know these symptoms, but I'm going to say them again. They are cough, fever, shortness of breath, diarrhea, nausea, fatigue, runny nose, sore throat, headache, loss of taste or vision. So even if you think if it's something else, even if you think it's probably nothing, maybe you're just whatever, just tell somebody. It's not an inconvenience to anybody. And we'd much rather you go through a little extra testing or inconvenience than to infect more people if we can prevent that.
Okay. Do you mean taste or vision, or taste or
smell? Taste or smell.
Okay. And then we have a running spreadsheet. I haven't checked it since we dismissed our morning meeting, but they're supposed to be putting that in a Google Doc that they're all shared on.
Beautiful.
Mm-hmm.
All right, true or false? HIV is a genetic mutation that always leads to AIDS.
False.
Very good. It is a viral infection that can lead to AIDS. True or false? You can get HIV from sharing a cup of water with someone who has HIV.
False.
All right, good. Yeah, it's mostly sexually transmitted, but definitely can be transmitted through the blood. For example, sharing needles, needle sticks, and other blood-to-blood exposure. And it cannot be transmitted through non-bloody kissing, sharing cups, sharing a toilet, coughing, or sneezing. True or false? Hep C is caused by a virus that primarily causes inflammation of your spleen.
Mainly falses.
Huh?
Mainly falses.
Mainly falses. Very good. It primarily causes inflammation to your liver. True or false? Some people can clear the hepatitis C infection by themselves without medicine.
We've got some very tentative falses. One true. They're very non-committal on this one, Charlie.
Well, good. I can teach you something. Yeah, about 20% of the people who end up getting the infection actually can clear it on their own. So, yeah, there are people who have it and have no idea that they had it and don't ever have to suffer any consequences of that. But then there are 20% of people who will go on to develop more significant liver disease and cirrhosis, and 20% of those can develop liver cancer. True or false? There's a vaccination for Hep C.
Right is false, right? So mainly falses. No,
Very good.
Wait, I'm sorry. Yeah, I know. I'm trying to get no mainly truths. I'm sorry. Again, I'm facing them. So
Left is true, right is false. There is no vaccination. The answer is false. There is no vaccination for hepatitis C. So you guys, I think all of you have been vaccinated for hepatitis B, but there is no vaccination for hepatitis C.
There is one also for A.
Yes, there is also one for A.
C does not.
Yeah, and so I mean these things are important for you guys to kind of think about and be aware of, because there will be needles that you'll see on the streets as you're walking around, and so yeah, we have a pretty good amount of Hep C and HIV in our community, and so these are things that you're not necessarily like immune from as you would be for Hep B. True or false? You can have hepatitis C and have no symptoms.
That's true.
Yes, that is true. Which is different from hepatitis B, where symptoms are typically nausea, vomiting, jaundice, abdominal pain, and fever in the acute phase. True or false? There's a cure for hepatitis C.
Right is false. So no. Lots of falses. People have not been watching TV lately.
So when I first gave this talk, well, I've been giving this possibly for the last 7 years, but yeah, there used to not be a cure for hepatitis C. In the last couple of years, we've come up with some, and they're a lot more tolerable and a lot more effective. So there are tons of patients right now who are getting treated for Hep C, and it's wonderful. So anyway, what does all of this mean for us? It means universal precautions. You must treat all body fluids, with the exception of sweat and tears, as if they were infectious. And you must also treat all respiratory droplets as if they are infectious, including your own. I would strongly recommend you wear gloves. if you know that you're going to be, or if you think you're going to be coming in contact with body fluids, and then yeah, I mean safety sharps containers, but I don't think you guys will have to deal with that too much. So yeah, when you're walking in the streets, please wear closed-toed shoes. Be mindful where you're walking, where you're stepping, and yeah, what you find there. And I think that's it. Wear a mask, stay as far apart as you can from people. Any questions? All right, great.
All right. Thank you, Charlene.
Thanks, guys.
How can we pray for you, Charlene? I know you have a very busy household with every.
Oh, that's such a nice question.
Your brother-in-law's living downstairs still, right?
Yeah, he's living downstairs. We're all pretty good right now. I guess, yeah, sort of maybe the transition for my new position and, you know, continued growth as we, yeah, figure out how to supervise and lead students at Esperanza.
So Charlene is going to be the head of the student rotations and student mentoring here. So meet your new boss if you decide to come back. Charlene Chen, meet your future rotation people.
Yes, yes. And I look forward to seeing you guys around the offices.
Okay. Cool. Yay, thank you.
Thank you.